Good morning. Today I am going to show you one important surgical video. This is the dequervain release of the wrist joint. In this, we are going to release the tendency of first compartment of dorsum of the wrist. As you know, this is either called radial styloiditis or dequervain release. And mostly this kind of cases doesn't require surgery. But this guy have already took the corticosteroid injections, physiotherapy since last 6 to 8 months, but nothing works. And as he is the manual lateral, so now we are going to release the tendency of the first compartment. So now I will take you to the step by step of the surgical video of this procedure.
Okay, start. So this procedure I am going to do under the tourniquet, and if you are not using the tourniquet, you can use the 2% lignocaine with adrenaline. That will help in the stop the bleeding, and you will be comfortable doing the surgery. So now we'll do the site marking, and I have done the site marking at the radial steroid and 1.5 to 2 centimeter proximal to the radial steroid. We are going to give incision. And one most important thing, you have to take care of the superficial branch of the radial nerve. So now we'll start the incision and then we'll come back to you. Just engaging the incision little bit. Stop. Okay. So now I have made the dissection, and we have retracted the skin and soft tissue, and this is, you can see the superficial branch of the radial nerve. Along with this, we found some vein. It's a cephalic vein, branch of the cephalic vein. Okay, and now I'm going to retract this. So on the laterally on the dorsum side, and after retraction, you can see there is a clear glistening structure. There is a clear glistening structure, you can see this. So now we are going to release this. Sometime these two tendons are in the one sheath, or sometime it will be in the two different sheath. So we will dissect the tendon and we will see how it goes. Can you give me the knife, please? So always be careful about this nerve. This is the only important things in this surgery. Can you rotate this? Keep it left. And try to keep the wrist always in the neutral position. So now I'm going to release this tendon. Try to be on the dorsal side. Can I hold this, please? So now I'm going to release this. You can see this tendon. So see, this is fluid is coming out. This looks like inflammation. And now we release this. After that, you can see the tendon clearly. So now we have released, and you can see below this is the tendon. So when you dissect clearly, tendon will be visible.
Yeah, now you can extend. Now it's clear.
Now it's
Especially the
clear.
retractor.
So now I made the dissection in this tendon sheath. We have to make the extension in the distally. Along with that, we have to make this in the proximal part also. Okay, and give me the artery. One artery, please.
Can I stop?
No, it's okay. I will try to retract the tendon. This glistening structure, you can see this is the tendon. So this is the only one. We will find another one also. Check where is the other one. Stop.
Yeah, stop.
So now I took the two tendons. One is abductor pollicis longus and another one is extensor pollicis brevis, which is on the volar side will be the abductor pollicis longus. This will be the extensor pollicis brevis. On the other side there will be the second compartment of the wrist joint. Now this is the volar side, this is the dorsum. So I'm going to extend the dissection till distally and little bit proximally for the full tendon release, and at the end I'll come back to you again. So now we have exposed the tendon, and this is synovium. You can see this is little bit thick, and because of that the patient is having pain. So we are going to dissect this with the scissor. It's down. So I'm going to release this one. Just releases some part of the synovium, so that the chances of recurrence will be very less. Just release this one. And this is the extensors. You can see this 1, 2, and this is the another one. This is on the volar aspect of the tendon sheath. Just can show me here this side extension. As you can see, this is the thickening here. You can see this is very much thickened. So now I'm going to release this, but not completely, to keep the tissue in the proper place. Just cut it.
Stop.
So now we have released everything, and you can see this is tendon is clearly we can see. In the distal direction also you have to check, it's free, tendon is free completely, there is no tunnel. And this is the proximal direction, and this is the vessels, and this is the superficial radial nerve. These are the very much important things. Okay, and now we'll have a wash and do the closure.
Show me one more time.
So we are going to put the cosmetic stitches in this, so that scar will be less.